Hi, my name is Tim Long. I'm the Administrative Clinical Director for New Life Medical Center. And today I'm going to talk to you about the testosterone replacement therapy for men and the injection intervals that we suggest you follow. I'm going to give you the differences between a 1 week, 2 week, 3 week, and a 4 week interval. And I'll show you on a graph here in just a minute how that's going to affect your testosterone and how you feel. The first thing we need to talk about is name brand testosterone or medications versus compounded. We only use name brand, which means we buy directly from the wholesalers who buy from the manufacturers who manufacture the medications. We don't use compounded for testosterone therapy, for testosterone, or for HCG. And there's a reason for that. Compounded products have, you can have a 20% variance and still be considered within normal ranges. So you can be 20% high or low. So with name brand testosterone, when you're getting, you have a specific dose, you're going to get a specific result, and it's going to stay that way. For example, I've been on the same dosage. I'm on testosterone therapy myself, and I've been on the same dosage for years. Literally the same dosage. My testosterone level stayed about the same. The only time they would change is usually when I would have a life event that caused a lot of stress, usually like a divorce or death in the family, whatever it may be. Then you'll see some changes then. But for the most part, if your life is pretty normal and steady, your testosterone level should be pretty steady and your dose should be pretty steady. Well, when you have compounded products or medications, that's not the case, because there can be a variance in between each batch that's made, even by the same pharmacy. We get called all the time by these compound pharmacies and we reject them. And the reason people use them or clinics use compounds because it's about 6 times less than the name brand product. So it costs a lot less. But when it's happening, because there's a 20% variance, high or low, the patient ends up feeling like he's on a roller coaster, because at a certain specific dose, at one point he was feeling pretty good, and all of a sudden he doesn't feel good anymore, but it's the same dose. Well, it may be because they're using a compounded pharmacy and they're not within that variance, and it's a lower strength this time. Well, sometimes they're at one specific dose and they're feeling great, and all of a sudden they start having all these side effects, or it gets too high. Well, it's because of the compounded pharmacy. It's just not following the strict guidelines as the manufacturers do. So we only use name brand medications for testosterone therapy, like HCG, for testosterone, cypionate itself. The next thing we're going to talk about is the half-life, and that's going to affect how often you get your shots. The half-life of any medication is just describing how long, at what point is half that medication gone or been metabolized by your body. So the half-life for testosterone cypionate, the name brand product, is 7 to 8 days. So what that means is when you get your shot, it peaks in 72 hours, which is about day 3 is when you'll be at the highest point. And at day 7, half that medication is gone, has been used or metabolized by the body. So it's not, when you're on testosterone therapy, it's not a situation where you get one shot and be done for the month. It's kind of like with food. Your body is constantly using it, metabolizes, uses it, and you have to replenish the food. Well, same thing with testosterone. Your body's using the testosterone. The more stressful, more active you are, it seems to be you're going to use it more often or quicker. But you have to replenish the testosterone. So at day 7, it's half gone. Day 14, it's about 70 to 80% gone. And at day 21, it's 100% gone. So if you got one shot a month, for example, and we'll show you the graph, you'll feel good for a few days, and then you're going to not feel a difference for the rest of the month. The symptoms are going to come right back. So next thing we're going to talk about is the intervals. Now, I pulled this graph off of PubMed. The link is on the website, and you can go to PubMed and look this up yourself. Just look up testosterone replacement therapy injection intervals, and you'll be able to find several studies on that. But I'm going to show you this graph. Now, this graph, don't pay attention to these numbers or these values. It doesn't have anything to do with this, what I'm about to show you. But this is a 1 week interval, 2, 3, and 4 week interval. And what you want to do is stay above your threshold. Now, every guy is different. We call it threshold or the sweet spot. And that is whatever level it takes for you to get to the point where your symptoms disappear. Every guy's different, so you can't really get caught up on the number. You can't get caught up on the dosage. What you need to look at is, how do I feel? When my symptoms disappear and they don't come back, that's the level I need to be at, and that's the dose I need to be at. That's how we're going to look at it. So every guy's different. There may be a guy who feels great at 450 or 500, and there have been another guy that feels great at 800 or 850. So both of those are within norms. So what's the most important again is, how do you feel? Don't look at a number. More is not better. It's, how do I feel when your symptoms disappear? So let's get back to the intervals. As you see there, what happens is on day one, this is on a weekly injection, which is what we do here in the clinic. You get your initial injection. It peaks about 72 hours. So it gets above your threshold, which is where your symptoms disappear. So you start to feel good. You feel good for a couple of days, and it starts to go back down. You get your second injection. It builds upon the first, and then peaks about 72 hours later and starts to drop. And then you get your third injection. Now, at this point, you're above your threshold, and everybody's a little bit different. It typically takes about 4 to 6 weeks to get to this point. This is shown in about 3 to 4 weeks. But you slightly dip down there, so you may feel bad for a couple days. Then you get your injection, it pops back up, and as you can see here, by the fourth injection or fifth injection, at your lowest point, you're still above your threshold. And that's what you want. Is you want to be on your lowest day before you get your shot. On the day you get your shot, that your level's still above that threshold, so that your symptoms don't come back. That's the whole point. If you're going to be on therapy, you want to feel good all the time. You want to have a yo-yo effect. So that's how you can accomplish that. Another reason is, when you are getting your shots on a weekly basis, you can usually use a lower dose. And the lower the dose, the less side effects you're usually going to have. And that's purely anecdotal, but that's what we have found in the clinic. Now on a 2-week interval, as you can see here, you get your initial injection, it peaks about 72 hours later, and it starts to drop, but now it's dropping, and you'll get your second shot for 2 weeks. You get your injection, it peaks in 72 hours, so you get above that threshold, and it starts to drop, and for week 4, you get your second injection. As you can see there, you only stay above your threshold for a couple days at a time. So the vast majority of the time, you're below the threshold. Same way with week 3, week 4. Most of the time, you're below your threshold, which means you're below the point where your symptoms start to come back. So, as we have found here, if you do the research online, get on YouTube, listen to other doctors, they're going to tell you need to get it about every 7 to 10 days. The more active you are and the more stressful you are, you're probably going to be closer to the 7-day mark. But if you have a pretty easy, your life isn't very stressful, and you don't get out, work out all the time, or you're not out physically working, you may be able to get by with a 10-day interval. Everybody's a little bit different. The only way to know that is to test it and do the labs. But from what we have found is the 7-day interval is what works best. So what you need to do if you're going to start therapy is just know this up front, that if I'm going to feel my best, I probably need to take testosterone on a weekly basis. And of course, we look at every single patient, and we look at their labs. We'll talk about that in just a second. But we treat each individual patient as an individual. Everyone is completely different. There's no one that's exactly the same. So we're going to work with you, talk with you, pull the labs. In the beginning, we're going to pull labs every 5 to 6 weeks until we find out what your threshold is and what your dose is that works for you, where the symptoms disappear. And then we're going to do labs every 3 months minimum. If there's anything that happens in the meantime, because we're going to see you every week, and we're going to sit down and talk to you every week, we'll pull labs again. So we do lots of labs. We're very conservative. We watch you very closely. So we're going to be watching very closely. So if you decide to do testosterone therapy, it's going to be safe. But what you need to decide is, if I'm going to start testosterone therapy, it's a lifelong commitment. Now, what I mean by that is, it isn't life and death. If you get on testosterone therapy and then stop, what will happen is, after about 2 or 3 months, your body will get back to where it was before you started testosterone therapy. So it's not going to totally knock out or ruin or eliminate your own production. It will initially, but you will, after about 2 to 3 months, your production will kick back in, and you will get back to where you were before you started therapy. So your symptoms may come back, will probably come back, and you'll go back to feeling like you did before you started. So, but what I mean by a lifelong commitment, if you want to feel your best and eliminate all the symptoms and have the recovery, have the drive, have the sense of well-being and the mental sharpness and the sleep and everything that comes along with it, you'll have to stay on it the rest of your life. Because again, it needs to be replenished. So if you're going to start therapy, the best way to do it is do it consistent enough where it keeps your levels above your threshold so the symptoms don't come back. Or I suggest not even getting on therapy at all. Because once you start therapy, if you get a shot every 3 weeks or once a month or even every 2 weeks, you'll feel good for a couple of days, and then you drop down and feel horrible. And you're going to blame it on the testosterone therapy is not doing anything. Well, that's not true. So if you have any questions about testosterone therapy, just call the clinic or drop by. We're glad to sit down and talk to you about it. We're always here for you. Thanks.